Welcome back. You're watching McLaren Port Huron's Today's Health, and we're talking with orthopedic surgeon Todd Murphy. All right, in this segment, we want to talk a little bit about shoulder separation.
Okay.
What happens?
So when a shoulder separates, here's another diagram of that shoulder, and here's the collarbone again, and then here's your shoulder blade. And what happens when the shoulder separates is a force comes down and hits the shoulder blade. And you can see here the clavicle is held down even with that shoulder blade by ligaments here. There's actually 4 ligaments here, in the top, the bottom, the front, and the back. And then there's 2 very important ligaments that attach to your scapula here, or your shoulder blade. And these 2 ligaments here hold the clavicle down too. So different degrees of sprains to this, but it's a force that comes down right on the shoulder blade there and disrupts either these ligaments, or in bad injuries, these ligaments plus those ligaments.
What are the symptoms of a shoulder separation?
Pain. These are painful. So it's usually a blunt force that comes down, and sometimes you may see some swelling on the skin right here. In worst cases, you'll see an obvious deformity where there's a bump where the end of this clavicle actually springs loose a little bit and is underneath the skin.
So what type of athlete has this type of injury?
The number one sport that I see these injuries in is hockey. Without question, this is the most common hockey injury that I see. The second most common is probably American football. And then third would be recreational athletes diving, again, diving for balls or falling onto their shoulder, getting tackled in recreational type sports.
Can you prevent this type of injury?
Only by not playing those things I just said.
I see. Probably not the right answer
Right.
for them. So is it instant pain?
Yeah,
and
they know
pain
they
that,
did it. I've actually,
okay.
this happened to me when I was a kid. You feel it right away. It's not fun.
So how do you make a diagnosis then?
Well, the patient will come, just looking at them and listening to them usually. Again, the patient's history, they pretty much tell me what they did. But for instance, if I saw a hockey player, it's usually he got checked into the boards and sudden onset pain, quite a bit of pretty sharp pain right there. Patients are usually pretty uncomfortable. Depending on the severity of the injury, once I have the patient take their shirt off and have a look at that, it's pretty obvious just touching it or just looking at them what they did. And then there's some other subtle physical exam things, but usually for an acute injury, it's pretty obvious in the office.
Does the shoulder work at all?
Yeah, the shoulder works great. It's real painful, so they don't want to move it. But once that acute inflammatory phase goes down, then they can use the joint well. And then certain motions, like bringing the arm across the body, will bother them for a little bit longer.
So what are the treatment options?
So rest. So for instance, if there's a lot of different grades of this injury. So if these ligaments are kind of the key. So if these ligaments aren't involved, then it's a sprain of this capsule. It's pretty painful, so pain relief, usually anti-inflammatories work pretty well. Rest, sometimes I'll have a patient use a sling until they feel comfortable to come out of it. They don't have to sleep with it on, but just to rest it. There's not really a physical therapy that speeds that up. It just, the body has to recover from it. Now, it's a different ballgame a little bit if these are torn too, because then you're starting to get into a more severe injury. But again, most patients do really well with rest, a short course of physical therapy, and then I let them get back to sports when they feel like they can do it.
So this isn't something that you can surgically repair?
Oh, sure, if the injury's bad enough. So if that injury, I think we have a picture of one that we did do surgery on. So this patient, you can see here where the collarbone is raised up above the shoulder blade right there. And so this is a bad injury where those ligaments over here have been disrupted, plus all 4 of the ligaments around there. A lot of times those patients will do really well with non-operative treatment. I'd say 8 out of 10, I usually tell patients give it some time, because 8 out of 10 or more will do fine without an operation. You'll have a bump, but the only other option is to trade that bump for a scar. But this is an example of a patient that didn't do very well. I think she was 8, 9 months out, still having a lot of trouble, and this is the same patient. And you can see now where what we do is we loop a graft through the clavicle right there, and it goes around that coracoid, and that brings it, and you can see her, she's nice and symmetric. So that's been repaired down, but that's surgery, recovery. but she's done quite well.
And it takes a little while before you can get back to doing what you were doing
Yep.
that caused it.
Yeah, most patients are a little apprehensive because they don't, because you're sending them right back to do what brought them in to see in the first place, but they get back to it.
Okay, we're going to take a break and come back and finish up talking about shoulders.